Hello, and welcome to Bite-sized MRCP, a manageable way to digest the things that you need to know for your MRCP examinations. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We are not associated with any MRCP examination organizations, and the materials cover are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exams and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on mixed connective tissue disease under the section of rheumatology. So what is mixed connective tissue disease? It is essentially an autoimmune condition that has features of more than one connective tissue disorder, which frequently presents as an overlap syndrome. In terms of the epidemiology of the condition, it affects female far more frequently than males, with a ratio of about 15:1. And the mean age of presentation is approximately 37. As for its clinical features, it could have features of more than one or all of the following conditions, including scleroderma, inflammatory myopathies, and systemic lupus erythematosus. And the common manifestations that you could encounter in your clinical vignettes or your PACES exams really are Raynaud's phenomenon, synovitis, myositis, and swollen hands and puffy fingers. GI manifestations are also quite common, especially if there is a concern about scleroderma, such as having significant reflux disease or esophageal dysmotility. And finally, pulmonary artery hypertension and lung involvement in the form of interstitial lung disease is also quite common, with approximately 75% of patients unfortunately suffering from this. So in terms of the investigations that you would want to consider in doing on someone who you're suspecting a possible diagnosis of mixed connective tissue disease, really you would want to be starting from your basic blood test, which probably the most important one would be your full blood count. And this would to check for any evidence of anemia, leukopenia. You also want to be checking for any evidence of hypergammaglobulinemia. Rheumatoid factor is positive in about 50% of cases, and very commonly you would have a positive anti-nuclear antibody, and that's virtually in about 100% of cases. However, the most specific antibody in this condition would be anti-URMP1, which is quite a common exam favorite, especially in terms of multiple choice questions. As for its prognosis, it has about 80% 10 years survival, and patients with scleroderma, polymyositis, predominant features typically do worse, and unfortunately this is mostly due to the fact that they are more likely to have evidence of lung involvement in the form of pulmonary hypertension. And the 10-year survival for those group of patients is approximately about 30%. As for its management, the management is really directed according to which syndrome and which features are present in the patient, and you really want to sort of target the management according to patient symptom. Do feel free to see our previous videos in which we go in depth and talk about the treatment options available specific to systemic lupus erythematosus, as well as limited and diffuse systemic sclerosis. So let's do some questions. Question 1. A 40-year-old lady presents with 3 months history of butterfly rash on her face, arthralgia, puffiness of her hands and proximal muscle weakness. The GP sends the patient to the rheumatologist suspecting a diagnosis of mixed connective tissue disease. Which of the following antibodies is the most specific in this case? So the vignette is quite straightforward in the sense that it already gives you the diagnosis that the GP is suspecting, quite rightly so, in this patient. The options that you've been given is A, SCL70, B, ANA, C, URMP, D, anti-Rho, and E, JO1. And if you remember, I mentioned to you earlier that the most specific antibody to mixed connective tissue disease is anti-URMP. You indeed do get a positive ANA in virtually all of the cases of mixed connective tissue disease. However, that is not the most specific antibody. Options A, D, and E have been covered in previous episodes, and they are the most specific antibodies to other conditions, which you're welcome to go and see our previous videos to refresh your knowledge on. Thanks for listening to this episode of Bite-Size MRCP. If you liked what you heard today, give us a thumbs up and hit the like and subscribe button to make sure that you don't miss our next episode. Let us know in the comments which topics you would like us to cover in the future. See you in our next episode.